my name's Chandler, and today I'll be doing my check-off video on how to intubate a patient. So currently this is Mr. Joe Brown. Mr. Joe Brown was brought into the ER. He was found down in his house, time unknown, and the doctor has ordered that he be immediately intubated because of his current position. So I'm gonna gather my equipment first. So I have my ET tube. I'm gonna use a 7.5 on him. We also have other sizes present. We have an 8, we have a 7. I have my manometer. I have my kaleidoscope handle. I have my blades. I have a couple of different ones to choose from. Stethoscope. We have our pulse ox. We have our 10 ml syringe. We have our CO2 color change detector. We have our stylet. I feel like I'm forgetting something. We have our tube holder. We have our tape for that, and then I think that's everything that we need. So I'm going to wash my hands. I'm going to verify that this is the right patient, review the doctor's orders, check his wristband for name and date of birth. I'm going to put on gloves. I have verified that the kaleidoscope light works. I've verified that my BVM works. We also need a BVM for this. So we have that ready, and we also have a BVM mask as well. That's what I was forgetting. So that's all of our equipment that we need. And then we're gonna go from there. So I'm gonna go ahead and glove up. Khalees is going to be my assistant today. I'm going to introduce myself to Mr. Joe Brown. He is currently unconscious. I'm going to explain to him, I hope that he can hear me, that we are intubating him because he is having a difficult time protecting his airway, and we need him to have a strong one so we can get him the appropriate oxygenation. Couple risks of this: we could call it airway trauma, we could call it bleeding, we could cause him to aspirate, and we can try to prevent this the best that we can by suctioning and oxygenating the patient pre and post intubation and monitor the patient's vital sounds. So to go from there, I'm going to place my patient in the sniffing position. Khalees is preparing my 7.5 ET tube with the milliliter syringe and the stylet. And then she's going to hand me a 3 Mac blade. So I have my Mac blade, I have my handle, and I pop it in. There we go. Okay, lights on. So we are pre-oxygenating our patient. We have patient placed in sitting position. Ready? Ready. So I'm going to sweep the tongue out of the way. I visualize vocal cords, so ET2 please. We're gonna go. It's stuck. Alright, I'm going to exit. Please pull the stylet. Check in for color change. Color change detected. Cuffs inflated. Can you check for breath sounds? I'm going to take over. Bilateral breath sounds. I'm going to order a chest x-ray stat to confirm the proper ET placement. And then Khalees is going to go ahead and secure the tube. So we're going to apply the tube holder that has the sticky facial pads. And we're going to tape it to secure it.
placement is 23 at the teeth. Tube is taped.
Okay. Now we're going to check the cuff pressure to make sure we're not causing any barotrauma.
Pressure is 25, between 20 and 30.
So cuff pressure is perfect. We have our ventilator here, so we're gonna go ahead and hook him up to that. We're gonna pretend for that purpose. So we have attached the patient to the vent. He is doing well. Make sure we're not forgetting anything. We have him taped, and we have all done the things. I'm then gonna go ahead and re-evaluate my patient. I'm gonna listen to breath sounds. I'm gonna check their vitals. I'm going to assess for any airway trauma. At this time, I do not see any. There was no bleeding. There was no aspirations. Lateral breath sounds are good. Vitals are good. There is no need for secretion removal at this time. So, patient stable, and we've done what we need to do. So I'm gonna go ahead and remove my gloves, wash my hands, pick up any of my disposable trash that I made a mess of, throw that away, and then go ahead and chart everything that I did today and let the doctor know that we are intubated and we are good to go.